Hi, everyone. My name is Luke Elzinga. I'm the Communications and Advocacy Manager at DMARC, and today I'm going to be walking through some of the key findings from our Portrait of a Food Pantry Visitor report. So this was a report that we recently put out looking at data, demographics, and disparities in our food pantry network in fiscal year 22. First, just a little bit about DMARC. So the Des Moines Area Religious Council is an interfaith organization. We've been around in the community since 1952, celebrating our 70th anniversary in 2022. And our mission is working together to meet basic human needs for the greater Des Moines community. The primary way that we do that is through our food pantry network, which consists of 15 partner food pantries, our mobile food pantries that visit numerous locations around the metro, and we also have a no-contact home delivery program as well. Our food pantry network's been around since 1976, and we strive to provide nutritious food. People can access a 3-day supply of food once per calendar month. But we also have additional items that are available on a daily basis. Some of those don't always meet our healthy food guidelines. It's a lot of bread in the summer, extra produce, could be food rescue, things we're trying to move quickly throughout the system. Here's a little bit about how DMARC is using data. So we operate a shared intake system and database at our food pantries. Visitors are asked a series of 12 to 14 questions about their household to help us understand the needs of that household and the broader needs of the community. And I want to specify that the data shared in this report is only for people who are going through to get that 3-day supply of food. Our anytime items do not require people to go through the intake process to receive food. So some of these counts, especially around average number of visits, are probably undercounts compared to if you were to include all of the anytime visits that we see. Because we aren't doing a intake for those, we don't really have a way to track them. So I just wanted to make you all aware of that. The data is shared through a data visualization dashboard that we have here. And data is anonymized to protect the identities of the people we assist. So how we use this data is in meeting with legislators, community leaders. We can talk about specific food insecurity statistics in their particular district or ward. We also use this information to educate the public and funders about the realities of hunger and food insecurity. And we also use this data in a number of reports, including this one. So a little bit of background on this report. We're often asked what a typical visitor to a food pantry looks like. And as you will see, we assist people of all races, genders, ages, incomes, and educations. There is not one typical visitor to a food pantry. This report really aims to highlight the stark disparities that we see in our community among people who use food pantries. And one really important thing to note here is that these disparities are the direct result of historic policies rooted in racism, sexism, and classism. They are not happenstance. Before we get started, just wanted to acknowledge that we are located on the ancestral land and territories of the Bakotsi or Iowa, Sauk or Sac, and Meskwaki or Fox peoples. This land was taken by force and coercion of white colonizers and the government of the United States. We wish to pay respects to elders of the past, the over 1,000 Native Americans currently residing in our community, and future generations. So let's get into the key findings from this report. The first finding is that racial disparities among food pantry visitors exist in all communities across Greater Des Moines, but are especially pronounced in the suburbs. So this really points to the different financial realities between white, not Hispanic people and people of color in our community and specifically in suburban communities. So we're going to walk through a few graphs here. This is for the city of Des Moines. And on the left side here, we have the general population. And on the right side here, we have residents of Des Moines who used a DMARC food pantry in fiscal year 22. And this is broken down by race and ethnicity. So as you can see, while white, not Hispanic people make up 66% of the general population of Des Moines, only about 46% of the food pantry visitors that reside in Des Moines are white, not Hispanic. So we can very clearly see there's some racial disparities between the people in our community who are using food pantries and the general population. This is Ankeny. You can see on the general population, very white, 91% white, not Hispanic. And then looking at the food pantry visitors, you can see some clear disparities, especially for Black African-American people living in Ankeny. They make up almost 15% of everyone in Ankeny who used a food pantry, but only 1.7% of the general population. Here's Clive. I think this is one of my favorite graphs. The food pantry visitors, just such a neat diversity in the types of people that are using food pantries who live in Clive. But obviously, as you compare that to the general population, some extremely stark disparities there. 84% of everyone in Clive is white, not Hispanic. But the food pantry, people who are using food pantries who live in Clive, it's only about 23% are white, not Hispanic. So some very stark racial disparities there. This is Johnston. I think this is the greatest observed disparity of any group, is Black African-American living in Johnston. As you can see, only 3.2% of everyone who lives in Johnston is Black African-American. Among those people who live in Johnston and used a DMARC food pantry is close to 37%. So they're nearly 10 times as likely to use a food pantry than the general population. Urbandale, again, we see some very stark racial disparities here as well as in West Des Moines. So as you can see, racial disparities really exist among food pantry visitors in all of Greater Des Moines, but especially in the suburb communities, do we see those racial disparities arise. Our next key finding is children assisted by the DMARC Food Pantry Network are much more racially diverse, and seniors are much more likely to be white, not Hispanic. This really just points to the fact that our community is becoming more racially diverse. So this is just among food pantry visitors who were children. About 1 in 3 children who are assisted by the DMARC Food Pantry Network were white, not Hispanic. And you can see some of the other racial breakdowns here. As we look at seniors, about 70% of all seniors who use the DMARC Food Pantry Network are white, not Hispanic. And you can see the other breakdowns here. So clearly, this is just an indication that our community is becoming more diverse, and that is a good thing. Another key finding is that gender disparities exist across all races and ethnicities. Women are more likely to use a food pantry than men. And as age increases, that gender disparity also increases. So there's actually no gender disparity among children we see at the Food Pantry Network. But that level of disparity increases with age. from a gap of about 5 percentage points to a 16-point gap among seniors. I think this really points to financial disparities between men and women, the gender pay gap, life expectancy for seniors, and it also may suggest a greater reluctance to ask for help from men. So as you can see here, this is just looking at children who are assisted by the DMARC Food Pantry Network. And we can see there's not really much of a disparity, not a statistically significant one at least. This is the young adults age group, and you can see that we are already seeing about a 5 percentage point difference between men and women who are using the food pantry. Going to adults 25 through 64, that widens to over a 10-point gap. And then for seniors, we see about a 16-point gap between women and men. Our next key finding is that 1 in 3 households assisted in fiscal year 22 used the DMARC Food Pantry Network for the first time ever. This really just points to a high level of need in our community right now. So about almost 33% of all first-time households were first-time pantry visitors, and about 25% of all individuals were first-time pantry visitors. So you can see that first-time households had a lower average household size. So they were smaller households. One thing also to note is that 35% of all the new pantry visitors that we saw in fiscal year 22 came in April, May, or June of 2022. And in April of 2022, we really started seeing some dramatic increases in use at our food pantry network. Additional benefits that had been going out to people receiving SNAP during the pandemic ended in the month of April. And since then, we have just been seeing, again, a really dramatic and record-breaking rise in use at our food pantry network. Our next key finding is that 3 out of 4 food pantry visitors live below the federal poverty line. When we also look at this by race and ethnicity, we can see that white, not Hispanic people had a relatively higher income compared to other racial groups, but still vastly the majority living below the poverty line, which we'll see in just a second. So as we look at federal poverty level, 73% live below the poverty level. There's a small typo here on the side. Sorry, that should say federal poverty level 2022. And that has the breakdown there of what that federal poverty level is based on household size for 100% and 200%. So 73% of everyone we assisted lived below 100% of the federal poverty level, and 95% made less than 200% of the federal poverty level. So you can see how that kind of breaks down there. But I think the key piece here is that most of the people who are being assisted by our food pantry network are very low income. Here is the racial and ethnic breakdown of people living below 100% of the federal poverty level. So again, that average there is 73.3%. But you can see how that differs based on race and ethnicity. So as I mentioned earlier, white, not Hispanic as a group has a lower percentage of people living below 100% of the federal poverty level. It's only about 2/3. But when we look at other groups like Black African American, who about 82% are living below the federal poverty level, or other race or unknown, Hispanic is sitting at about 83%. So we can see there's, again, some clear disparities based on race and ethnicity and income in this case. Our next key finding is that more than half of all pantry visitors use a food pantry just once or twice a year. One disparity that we see here is that seniors and people who identify as Asian, Native Hawaiian, or Pacific Islander use food pantries at a higher frequency than others. And we'll get into some of that in just a second here. So this is just looking at overall usage among everyone assisted by the DMARC Food Pantry Network in fiscal year 22 on average. And again, keep in mind, this is only those who are going through the intake to get that 3-day supply of food, and does not include anyone who's coming for anytime items where they don't need to go through intake. So we see on average about 3.6 pantry visits in a year. 53% of everyone we assisted in fiscal year 22 visited a pantry just 1 or 2 times. And then you can see on the bar graph on the far right, that only 3.8% of everyone we assisted came all 12 months out of that fiscal year. Next, looking at seniors, we can already see a higher average number of pantry visits, about 5.1 pantry visits in the year. And just 38% of seniors visited a pantry just 1 or 2 times. Again, if we look over to that 12-month column, you'll see about 10.5% of all seniors we assisted used the food pantry every single month of that fiscal year. So most seniors who use a food pantry live on a fixed income, such as Social Security, and they're less likely to receive SNAP benefits. So this leads to a greater reliance on using food pantries more often to meet their food needs. One other thing I will note is that 25% of everyone who used a food pantry all 12 months of the year was a senior. This is looking at pantry visits by people who are Asian, Native Hawaiian, or Pacific Islander. So again, we see a higher average here of 5.0 average pantry visits in the year, and 38% visited a pantry just 1 or 2 times. And we see that 8.4% visited a food pantry all 12 months out of that fiscal year. Now, one thing that's really interesting in looking at this number is that this number is being completely driven, this higher number of average pantry visits is being completely driven by people who are employed or act as a stay-at-home parent or caregiver. When we look at other income sources for this particular group, we do not see this disparity. And so the average is being driven higher by people who are employed or act as a stay-at-home parent or caregiver. We also, for Asian, Native Hawaiian, and Pacific Islanders, see a much larger share of people saying they are a stay-at-home parent or caregiver. And our theory here is that these may be a result of 2-parent households where one parent is employed and the other is acting as a stay-at-home parent or caregiver, who are using these food pantries at a higher rate. And that may simply be due to the fact that the stay-at-home parent might have more time to access a food pantry than a household with 2 parents who are working full-time. This really is an area for additional research. It's not something that we necessarily knew already. It was something that came up as the report was being developed. And so this is something that we're really interested in and trying to understand exactly why that is. Another one of our key findings is that Hispanic and Latinx people are less likely to receive disability benefits, Social Security, and SNAP. We think this can likely be attributed to documentation status, limiting people's ability to be eligible for a program, but also due to fear of repercussions that even using programs, even when people are eligible. This came up a lot during the 2020 public charge rule under the Trump administration. That public charge rule stated that if you ever had to rely on SNAP or other forms of public benefits, that could essentially work against your favor when you're trying to work your way towards citizenship. So even for mixed status families who had children who would be eligible for SNAP, there's been a reluctance and fear of applying for that program, and fear that that could put someone's citizenship status at risk in the future. So as you can see here, this is looking at the percentage of food pantry visitors who are enrolled in SNAP at any point in the fiscal year. So on average, that's right around 42%. But you can see really clearly the three Hispanic groups are all quite a bit lower than the average. So multi-race Hispanic, other unknown Hispanic, and white Hispanic all are much less likely to be enrolled in SNAP. For other unknown Hispanic, it was only 25%. And we can see that some groups are also more likely to be enrolled in SNAP as well. And then as we're looking at Social Security benefits for seniors, this is the percent of seniors who listed Social Security benefits as their primary source of income. So again, for those three Hispanic groups, we see much lower on average use of Social Security benefits for seniors. So I'm going to go back real quick. So we know that Hispanic and Latinx people do not have as much access to governmental programs, which really underscores the fact that we need to be doing work specifically for that community in our food pantries to make sure people's needs are being met in that way. Our other key finding, racist housing policies of the past have lasting impacts to this day. We're just going to be looking at one policy of the past in this report, but there was a multitude of racist policies in our country's histories that have influenced present day. So again, just want to say that there are many, many other policies that have affected food insecurity, but we're just going to be focusing on redlining in this report. And what we found is that the same neighborhoods that were redlined nearly 100 years ago are still some of the areas of highest need today. This is the redline map of Des Moines. You may or may not be familiar with redlining, but for those of you who are not, this was a federal policy in the 1930s that established the Homeowners Loan Corporation. And these were for federally subsidized housing loans. Now, in part of setting that up, Holk commissioned risk assessment maps of neighborhoods. And as you can see here, it was given kind of 4 levels of ratings. A's and B's were the best. C's and D's were the riskiest. And one of the ways that Holk used to determine whether, a neighborhood was risky was the racial makeup of that neighborhood. And as few as one Black family living in a neighborhood could be enough for Holk to downgrade it to a riskier assessment. So ultimately, what redlining led to was federal loan supports for white families only if they were purchasing homes in white areas. And we see the impact of this still today. So this is looking at food pantry visitors who lived within the boundaries of this historic redline map we see here. So we assess people who live beyond these boundaries of this map. But looking just at those who live within the boundaries of the historic map, we see that about 71% live in either a C or a D district. And as you can see here too, there are some racial disparities here as well. White, not Hispanic, is the lowest with 68%. And multi-race Hispanic is right almost at 80% of everyone who lived in that area that used a food pantry lived in a C or D district. If we expand this beyond just that map to look at all of our food pantry visitors, you can see we've added a couple gray columns, and the lighter gray is folks who are living outside of the city of Des Moines. That darker gray is folks who still live in Des Moines, but outside that historic Redline area. So maybe those neighborhoods were not even really on the map in the 1930s. When we add that in, we see that still 43 or 42% of everyone we assisted lived within a C or D district in Des Moines. And again, some clear racial disparities. White, not Hispanic, is the lowest at 38%, and multi-race Hispanic is most people of that group live in a C or D district, about 55%. So in conclusion, these inequities are not unintentional, but they are by design, as specific federal, state, and local policies were created to advantage and disadvantage various populations in our society. And it's really critical to understand the ways in which previous inequitable policies influence and often negatively impact people's current realities today. All of the pieces and the key findings that we brought up have ties to policies of the past that could be based in discrimination based on race or gender or national origin. And we think it's really important to look at our current state of food insecurity with that historical lens to understand how those policies have shaped the current realities that people face today. We also think this report provides some areas of opportunity for our organization. First, as it relates to advocacy. So looking at this data, we can see the importance of SNAP for a lot of the people that we assist. And that when we increase access to SNAP benefits and increase SNAP benefit amounts, that we see less people needing to rely on food pantries to meet their food needs, which is a good thing. We also know that there's a lot of barriers to federal assistance for certain groups, and that people don't always have the same access to the same benefits as everyone. And that's a piece that we are going to be focusing on with our advocacy. It also really underscores the fact that there are a lot of people whose primary source of income is disability benefits or Social Security benefits who use a food pantry. And how can we expand the types of policy advocacy we're doing to make sure that those people have adequate disability benefits and Social Security benefits going forward? Another piece that we've been looking at is requiring minority impact statements on proposed pieces of legislation at the State House. We know oftentimes these disparities can come from unintended or intended consequences from pieces of legislation, and making sure that our lawmakers are considering some of those unintended consequences when they're debating and voting on bills. We also think this report presents some opportunities related to partnerships and outreach. Those include promoting high school equivalency degree programs for adults, providing outreach about SNAP and assistance with applying, especially for seniors, referrals to job training and placement programs, and pursuing a community ID for Polk County, which is something that we're working on with a number of coalition partners. This also presents some opportunities related to our services, including expanding our food selections at pantries to make sure that we're addressing the wants and needs of a diverse set of food pantry visitors, whether that's culturally appropriate food, food that meets people's specific dietary requirements like gluten-free, no sugar added food, and also targeted outreach to the Hispanic and Latinx community to build trust in using our food pantry network. There's also opportunities for further research here. So, we do our intake process and get a lot of data from that. but we really want to get a better sense of barriers that people are facing that leads to these disparities. And one thing we're exploring is conducting an annual survey to ask some of those questions that we might like to ask that aren't included in the intake process, and getting a large enough sample that we can extrapolate across the entire population. So I encourage you to read the report. It's kind of long, but you can maybe skim based on your, most interest. Please feel free to reach out with any questions that you might have. You can contact us at info@dmarcunited.org. We really want this report to be the start of a conversation. We don't want to just share the data and be done with it. We really hope that we'll have additional partnerships, ideas, and how we can improve our services come out from this report. So again, I really encourage you to read the report and shoot us any questions that you may have. Thank you for watching and enjoy your day.